sentence in this disclaimer. It says that these webinars are in no way designed to be medical references for the diagnosis or treatment. I'm trying to get my mouse here. For the diagnosis or treatment of medical illnesses or trauma. And really, folks, the idea behind this, and I know most of us, especially if you're over 50, we've been raised to believe, well, just live the life the way you need to live it, and if there's a problem, you go and see the doctor. Well, that is becoming very, very outmoded, and really it's becoming a dangerous philosophy to have. And our goal is not just to help people find answers, and really that's is actually debasing to think of what we do in that regard. We are not just looking for cures. We are not even just focused on prevention. Our focus really is on building strength in your body, in your mind, and your spirit, because as we said, the environment in which we live in today is a hostile environment, and you've got to know what it takes to strengthen, to protect, to enhance your body's ability, especially your immune system. And in this country, this culture we live in, the immune system of most people is subpar, to say the least. And so our focus again is on building strength. And to build strength, you really have to start from the beginning. Knowledge, understanding, how to apply the knowledge that is out there. And really there are tons of knowledge out there, tons of information on the websites and in books and everywhere. How do you make the most of it? And so knowledge is where we start from, and that's why we do what we do. We've sort of organized our approach to the physical aspect of our instruction, like the body, the health of the body. Remember, we focus not just on the body, but on the spirit and on the mind as well. But when it comes to the body, there are about 7 major things we look at. These 7 things we focus on, and whenever we get a speaker, whenever we approach a speaker or a presenter or a healthcare professional to speak to us, we kind of look at these 7 things, and we ask them to deal with one or more of these various aspects. If you remember last week, if you were on the webinar with Dr. Steve, he focused on number 3 right there, biomechanics, which is, well, he's a chiropractor, and we're looking at the spine and the importance of posture, alignment, and balance to the health of our organs. So these are the 7 main areas. And really, if you begin to understand these, if you're working with these, and again, you can go to our website, and we've organized most of our tools and resources along these lines. When you begin to understand these things, then you will be included amongst those who we call healthy people. And in these 4 points you see in front of you, what I call the profile of a healthy person. And of course, it starts with the mind, starts with good nutrition. It also involves being proactive, knowing what is out there and knowing how to protect your body and knowing how to increase your body's ability to function. And of course, an intelligent collaboration with the healthcare system. And I have to say this, if most people, I would say if 50% of the population knew about these and was working and had this practice on a day-to-day basis, I would have to say about over a quarter of healthcare professionals would be out of business. I wouldn't include our speaker today because he just has so many degrees behind him. So if the healthcare field doesn't work, which I doubt will not happen, but he has so many areas that he's involved in. He's a very, very intelligent man. We are really honored to have Dr. Kulisz to join us for this webinar to speak about a very, very important topic. I mean, I had no idea how important it was until I began to speak with him. So thank you, Dr. Kulisz, for being on, and Sherry is going to introduce you right. Well, go ahead, Sherry.
Okay. All right. Dr. Andrzej Alexander Kulisz is a native of Poland who immigrated to the United States in 1980. He specializes in natural health, the application of physics and mathematics in the development of non-invasive treatments, and the development and management of clinical studies. He has a strong interest in non-surgical and drug-free treatments, homeopathy, general naturopathy, and treatments through general fitness, nutrition, education, behavioral modifications, and patient participation. He believes the application of basic science to medicine, the growth of naturopathy, and nutritional treatments all play important roles in accomplishing this goal. He also stresses the importance of patients' learned and active participation in their treatments. Dr. Kulisz is a licensed naturopath in the District of Columbia, is a physician specializing in natural health, accredited in all countries of the European Union, board-certified American Association of Drugless Practitioners, and board-certified American Alternative Medical Association. Boy, that's a mouthful. Dr. Kulisz has his practice and lives in Tulsa, Oklahoma. So, Dr. Kulisz, are you there?
Yes, I am. Good evening, everybody.
Good evening.
Okay, well, let's start. We'll be talking today about incontinence, and just a note to our listeners, we are broadcasting today via Building Strength webinars. It is our first appearance, appearance of the European Natural Health Center that sponsors this broadcast. We'll be talking about incontinence, and the subtitle is "The Secret Women Do Not Want to Talk About But Should." Well, I spent quite a bit of time researching incontinence and eventually developing treatment programs and instruments. And eventually, as a result of this, I traveled quite a bit from London, probably from England, from one of the most prestigious Bristol Urological Institute, all the way to Singapore, through many countries of Europe and Southeast Asia, teaching elements of incontinence treatments and elements of female urology that has to do specifically with incontinence. So why is it that this is a secret women do not want to talk about but should? Well, about 90% of incontinent cases, maybe even more, are cases that women have. Men rarely have incontinence. And as you're going to see, let's set the stage here that women see doctors after they become incontinent, and men become incontinent after they saw doctors. This basic rule. And I have it here. I mentioned this first time in 1995 during Dutch, when I had a talk to one of lectures at the Dutch Urological Convention, and this gave me quite a bit of ovation there. It's probably a very good indicator that those doctors that were there agreed with the point. So let me talk about it in a slightly different way. Let me put some statistics here on the screen so you are going to see the prevalence of it. In 1996, there were about 13 million Americans that were affected with incontinence, urinary incontinence. Well, right now, there are no specific, we did quite a bit of research to update those slides. We didn't find anything other than we have been, basically, what we found out was that this number probably about doubled by now. So it's somewhere about 25, 26 million Americans that have to deal with incontinence. When it comes to prevalence among different populations, it's about 5% are men and up to 30% are women, somewhere between 10 to 30% depending on the age. And there's a very interesting thing that you're going to see in the next point, that about 28% of female exercisers are incontinent or have incontinent episodes, and those exercisers are somewhere between 18 to 21 years old, and only 26 of those that are 30 to 59 years old. I mean, the difference is quite small. It's about 2%, so it may not be statistically significant. Nevertheless, the point is that younger women have a lot less healthy lifestyles than those older ones, and very often this reflects on incontinence, and we'll have a time we are going to address this point. Let's talk about definition of urinary incontinence. Generally, it is said that this is loss of bladder control. It is a symptom. you are going to see different opinions about it, and this has to do with arbitrariness of how urinary incontinence is perceived. I consider it a symptom. It is caused by lower abdominal surgeries or injuries. It is caused by spinal cord injuries, usually quadriplegia or paraplegia, some other neurological disorders, multiple sclerosis, infections, interstitial cystitis. And